Hello and welcome everybody to another U of Care podcast. It is my great pleasure to welcome and introduce Dr. Barry Setlow with the Department of Psychiatry at the University of Florida. Dr. Setlow, would you mind introducing yourself?
Sure. Well, thank you very much for this opportunity to tell the audience a little bit about myself and about what I do here. Yes, my name is Barry Setlow. I am a professor in the Department of Psychiatry at the University of Florida, where I run a research lab that is primarily focused on issues surrounding substance use and particularly their interactions with cognition. And I've been here for about 10 years. And in addition to research, I also do a little bit of teaching as well.
That's great. So when you think about, obviously, most of our members in the U of Care Center are connected in some way to drug abuse and substance use disorders. And your extensive research has led you to a particular area of addiction and substance use disorders. What got you initially involved in this field? What led you down this path?
Oh, sure. So my graduate and postdoctoral research was primarily focused on trying to understand the neurobiological basis of cognition. And at the time, sort of toward the end of my postdoctoral fellowship, there were some papers published just out there in the literature that suggested that some of the consequences of chronic exposure to drugs of abuse in both in people, but also a little bit of evidence from animal models, was very similar to those deficits were similar to that resulting from damage to frontal lobe. And so, together with another postdoc in the lab, we set about to determine, can drugs of abuse, particularly cocaine, actually cause these same types of cognitive deficits? And we found that indeed they did. So suggesting that, let me back up a little bit. The particular types of cognitive deficits that we observed they were deficits that would tend to make maintaining abstinence more challenging. And so one of the hypotheses to lead from this work was that the part of the challenge of recovery and remaining abstinence is the cognitive deficits that could be induced by drugs of abuse themselves. Deficits tended to be in domains such as response inhibition and cognitive flexibility. And so we hypothesized that these deficits in these cognitive domains might essentially make it more challenging to stay abstinent, to become and to stay abstinent. So I became interested in this line of work and carried it through to an independent faculty position. I was on the faculty at Texas A&M University for about 7 years. And then continued that here at the University of Florida, where I've been for about the past 10 years. And in the course of this work, one of the things we found was that not only did chronic exposure to drugs of abuse, again, particularly cocaine has been our focus, cause these long-lasting deficits in cognition, sort of behavioral flexibility and response inhibition, and also deficits in different aspects of decision-making, so risky decision-making, impulsive decision-making. But in the course of this work, we also found that rats, and all of this work, I should mention, is done in rats, but we found that not only are there quite a few individual differences or individual variability in how rats tend to perform on these cognitive tasks. So, for example, individual differences in the degree to which rats make decisions impulsively or are willing to take risks in order to obtain a larger reward. So we find there are all of these individual differences just in your normal rat population, just as they are in humans. But we also found that these individual differences, particularly in risk-taking and impulsivity, tended to predict the rat's later predisposition for cocaine use. And so something about didn't necessarily play a causal role, but certainly suggested that these same behavioral phenotypes that might lead rats to be more inclined to make impulsive decisions or make risky decisions also predispose them to to cocaine use when they're given the opportunity to do so. And then the flip side of that is that then the drugs themselves can cause even further deficits in cognition. So it has the makings of a kind of a vicious cycle, and that if you're a rat who is particularly inclined to take risks, might be more inclined to cocaine use, but then the cocaine in turn promotes even further risk taking. So we're trying to now understand sort of what is the neurobiological basis underlying these, both the individual differences, but also how cocaine changes the brain to alter behavior.
Now, when you think about pathways involved in cognition and impulsive behavior, those are very complex pathways. This is like kind of I wouldn't say the holy grail, but it is kind of very complex behaviors that we're looking at, which are hard to understand, or that we're trying to wrap our head around just in, I wouldn't call it normal behavior, but just for us, even without drugs of abuse being involved, how do you then extend that to drug abuse if you try to look at dopamine, if you try to look at serotonin? There are so many different pathways involved, right? How do you try to tackle that out when it comes to drugs of abuse?
So, I mean, one small piece at a time is the short answer. And so, I mean, although you're absolutely right that complex aspects of cognition, such as decision making, engage huge portions of the brain, and different parts of the brain are going to be engaged differently at different slices of time during decision processes, and so we, rather than sort of looking at the whole complexity of the situation, we try to boil it down and say, okay, let's look at just one type of decision. Let's say choices between a small immediate reward versus a large delayed reward, where we're essentially asking our rats if they would prefer immediate gratification versus delayed gratification. And so it's known from lots of research in humans that an overly strong preference for immediate gratification is associated with a whole range of what you'd call sort of adverse or negative life outcomes, including substance use. And we also know that a history of substance use in animal models will cause an increase in preference for immediate gratification. And extending that from there, it's not hard to imagine that an over preference for immediate gratification could lead one down the road to initiation and continuation of substance use. So it makes sort of intuitive sense that aspect of behavior is linked to substance use. But this making these types of decisions is enormously complex, even when we can frame them or describe them very simply. So we take the perspective of looking at just a single brain region. So, for example, we published a paper last year where we're just looking at the role of one portion of the brain known as the amygdala. Now, the amygdala is very much involved in regulating and expressing, learning about sort of emotion and motivation. And so we wanted to know, how is the amygdala, and even more specifically than that, how is one portion of the amygdala, known as the basolateral amygdala, involved in these types of decisions? And so we find that, we find that, like so much else in biology, the story is even more complicated than we thought, because the answer depends on when you ask that question. And so we employed to ask these questions, we employed a set of techniques known as optogenetics, which allows us to very, with great temporal precision, just inactivate or turn off the activity of neurons within a particular brain region for a very short period of time, for just half a second or so. And so by doing so, that allows us to probe the function of a particular brain region. So we use these optogenetic tools to probe the role of the basolateral amygdala in these types of decisions between immediate versus delayed gratification. And we found that it seems to actually be doing two things, and that the results or the effects on behavior, on choice behavior, when we inactivate the basolateral amygdala depend very much on whether it's being inactivated right before the rats make a choice versus right after they make a choice and they receive the outcomes of their choice, suggesting that, okay, it's the story isn't as simple as the basolateral amygdala does this one thing, but it does multiple things, even within the context of this very simple situation. And so that was just in the context of normal behavior. So you're not in the context of drugs of abuse, but we're very much interested in, well, how, whether or how that role changes when you bring, let's say, a history of chronic cocaine into the mix.
Yeah, I wonder, because we often think about certain personality traits as we talk about a propensity for drug abuse in humans. Mm-hmm. Now, it seems to be a little bit like cognition and impulsivity are potential indicators or potential risk factors when it comes to personality traits, not only in animals but also in humans. And we have known these as potential factors that risky behaviors are likely to contribute to a higher risk of drug use in adolescence and then carrying on into adulthood. And now we see that in animals as well. So kind of a personality trait in animals as well as in humans, basically, risky behavior kind of as and now you kind of can establish that or link that back to neuronal pathways, basically.
Mm-hmm. Yes, absolutely. And so, I mean, I think, of these individual differences in our rats very much like personality traits in humans, with the caveat that, even, one's preference for, let's say, risk-taking or preference for immediate versus delayed gratification, I think even though even in humans tend to be often viewed as very stable descriptions or stable constructs, we're beginning to do, people are beginning to do this in human subjects, but we're beginning to ask these questions in our rats as well. Basically, the extent to which we can, these can be modified by experiences. I mean, not traumatic or not necessarily pathological experiences, but experiences of the sort that people might come about in their everyday lives. So the influences of peers who tend to be more on one end of the spectrum versus the other, or the degree to which they grow up in an environment that is, let's say, predictable versus unpredictable, and whether these kinds of factors can influence the way that these sort of rat personality traits, let's call them phenotypes to be more more scientific, are expressed. And so we're just in the early stages of doing this line of work. But I'm excited by this line of work because it's in part because it suggests that these traits are malleable, and if you can shape a person's environment or shape their history such that they might be more likely to delay gratification, well, that's probably going to be beneficial for things like resisting substance use or resisting relapse.
Yeah, I think so. That kind of really applies to your translational aspects of what you're doing in a preclinical animal model to the actual prevention and potentially also treatment options. If you can actually shift the perspective of an individual that is suffering from a substance use disorder, potentially to from an immediate gratification point of view to a delayed gratification point of view. Do you think that is possible, that somebody who is potentially really kind of a neuronal rewiring, is that a potential possibility?
I think absolutely. And in fact, there are laboratories who are trying to address just these questions to determine if by, via cognitive training, then you can, over, let's say, weeks or maybe months of, essentially playing games along the line of, I think it's, Lumosity or Brain Age. They're almost video games, but the idea is to train your brain to work in a particular way. Sort of whether this kind of brain training or cognitive training can shift, people's behavior outside the laboratory. And I think the jury is still out on that, on whether how beneficial cognitive training really is for the real world, and to what extent there's carryover from outside the laboratory. So right now we're more focused on environmental manipulations, but some of it is simply proof of concept. Can these traits be shifted with experience? And not necessarily through specific training, although there's no reason that couldn't be a part of it.
So where do you see your research heading, and how do you think external factors like society perceptions, current public perceptions, and also the scientific funding, where things are going in the future, and where do you see particular challenges to your research, barriers that are in place that shapes your future research?
Sure. Well, I think there's always, when dealing with substance use, you're always fighting against, perception that, this is, something that's entirely, a conscious choice on the part of the individuals suffering from substance use disorders. But I think another factor, another challenge, both for the research field, but also public perception at large, concerns the variability in both the pre-existing conditions that people sort of grow up with, and that might predispose them or protect them against substance use, but also the wide variety of ways in which substance use is expressed. And so the stigmatization of substance use disorders and substance users, there's always a battle, and so it's always a challenge to try to convince people to pay attention, that yes, this is an issue that is really should be addressed, but also can be addressed. And so we don't want, although I think there's getting the public at large to realize that this is a brain, substance use disorders disorders are a problem of the brain, but I think there's a little bit of maybe not danger, but I think one has to be careful about pushing that too far, because we also don't want to give the perception that it is an intractable condition of the brain or an incurable condition, and that there's nothing to be done. Once somebody has a substance use disorder, it's just their brain and they're stuck with it. I think the malleability of substance use disorders is very important to emphasize, and to keep in mind. Both for a public perception perspective, but also from a research perspective, and that it is not it's not a permanent condition. It's a very challenging condition, but it doesn't, not necessarily a permanent condition, and that people change and the brain can change tremendously, and that there's tremendous individual variability in the degree to which people do change and their brains do change, and what their brains and of course the behavioral expressions resulting from their brains are actually doing, or what they're working with. So public perception and just the variability in human brains and behavior are challenging, but very important to keep in mind.
Okay, yeah, I think that is something that U of Care, one part of U of Care tries to address by having public outreach opportunities, by trying to be a driving force when it comes to not only talking among us researchers, among us scientists, but also opening up the discussion with the public about where we stand in terms of research, what is new when it comes to substance use disorders and to addiction, and what we can do together with the public and with policymakers and on the local, on the national level, to advance our understanding of substance use disorders and to not stigmatize it, and really help people, not only the individuals that are affected by it directly, but also on a larger scale, the communities that are suffering from substance use disorders, are affected by it, to improve outcomes. And I think your research contributes to that by addressing one very important aspect of that, that personality traits that are in, as you say, phenotypes. But I would go really, when we talk about humans, I think personality traits is really what kind of shapes them in early stages of their years, or in early stages of development, that are often intrinsic, right? If I understand that, risky behavior is often something that we develop early in our early years when it comes to taking risks or being more conservative or more liberal with it. I don't know. So I think there are some things that we can take away from that as a society, as we raise our children, as we go into school, and what the environment should look like in society to discourage risky behaviors in some regards, with keeping a balance between the two.
Yes, absolutely. Absolutely. And one of the things that I've really enjoyed most of all about my work through UF Care and interactions with my colleagues has been just the breadth of perspectives and the breadth of, levels of analysis that different laboratories and different investigators bring to the table. And so, for example, I've had the opportunity to work with the group in the Department of Epidemiology over the last several years, and that's been very eye-opening, just to have that different perspective on substance use. And from myself as somebody who works, whose research is only in animal models, just to have that more contact with the literally the human side of things. Obviously, the disorders that we're trying to address has been just wonderful. It's been a really wonderful opportunity.
That's great, and that's exactly what U of Care is about. And I enjoy that this is kind of strengthening collaborations. I think that's what U of Care is really about. Okay, thank you so much, Dr. Setlow, for taking the time out today and talking about your exciting research. And I really look forward to seeing more of your research coming out. That really gives us more opportunities to see that bridging and how cognition and impulsivity. I know that I'm very impulsive when it comes to sweets. That's really my impulsive. I'm not a risk taker. I know that much, but
no, nor am I. But some of I understand the inhibition when it comes to when it comes to some things on the table. Yeah.
But if it's only sweets, I know I need to control my weight. But that's my only addiction, so to say, my go-to thing. So thank you very much, Dr. Setlow, for taking the time today, and thank you very much for listening today. I look forward to the next UF podcast, and thank you, everybody. Take care.
All right. Thank you.